This is an SFU Gerontology 410 presentation on physical activity and sleep disorders in the aging context by TIANTIan. For older adults, poor sleep can be defined by a sleep duration of less than 5 to 6 hours per night. Statistics Canada reported from 2007 to 2013, over half of older adults reported having sleep disturbances. Sleep disturbances are closely linked with difficulty falling asleep or waking up multiple times per night, which can lead to problems in cognitive functioning and greater risk of depression. So what is insomnia? The National Sleep Foundation defines it as a sleeping disorder characterized by difficulty falling or staying asleep. Insomnia can be caused and affected by psychiatric and medical conditions, unhealthy sleep habits, specific substance use, and/or biological factors. Hence, medical conditions can influence sleep quality. This includes symptoms of discomfort associated with medical conditions. Chronic pain, arthritis, lower back pain, asthma, neurological conditions, and symptoms such as acid reflux. On top of discomfort, the medications to mediate these symptoms can furthermore disrupt sleep. To a somewhat degree, as we age, our risk of chronic diseases increases. Therefore, older adults are a vulnerable population of having sleep disturbances or sleeping disorders. In a longitudinal study, Holfeld and Ruthig examined sleep quality and physical activity in older adults. What they found is that there's a bidirectional relationship in sleep quality and physical activity. Poor sleep quality is often associated with a decreased desire to engage in physical activity, while regular physical activity can improve sleep quality. The pathway to poor sleep quality is unclear in current research, along with co-founding factors, including one's state of health and well-being. This is because factors such as depression, anxiety, lifestyle, food, and functions of the brain can increase an older adult's chance of experiencing a sleep disturbance. Poor initial sleep can result in a lack of energy and can then impair daytime functioning. For older adults who have less than 5 to 6 hours of sleep per night are at risk of impaired cognition and memory, lack of motivation, and fall injuries. This is illustrated in a Malaysian study where they did a national cross-sectional survey, which showed that 20% of falls was associated with sleep disturbances, while only 14.9% of falls were associated with no sleep disturbances. This becomes especially higher in patients with dementia. Furthermore, older adults with continuous poor sleep are at risk of diabetes, cardiovascular disease, and mortality. This is the Pittsburgh Sleep Quality Index, which is an instrument used to measure the quality and patterns of sleep in adults. It asks older adults to report several areas involved with sleep quality. This includes sleep duration, sleep disturbances, or use of medication, as well as daytime dysfunction over the last month. There has been a challenge to establish if physical activity is effective for improving sleep quality. This is largely because we still do not know a lot of the biological underlyings of sleep problems, as well as time and resources to create randomized control studies. In one randomized control trial that I found, done in 2015, over 24 to 30 months, results showed that physical activity reduced 30% of poor sleep quality in new cases. For long-term or chronic poor sleep cases, there was insignificant evidence to suggest that physical activity had improved sleep quality. With this, they conclude that exercise in the long term can be beneficial nonetheless, as they suggest for future research to look into long-term physical activity regimes and their ability to improve chronic health conditions, which may be beneficial to sleep-wake behaviors associated with sleep disturbances. The overall consensus over multiple methods of research all point to that physical activity alone cannot improve sleep quality. Defining physical activity for older adults vary across studies. I came across two specific types of physical activities mentioned in studies. One can be expressed as leisure time exercise. This includes work-related activities, going for walks in the park, or joining community activities such as dance classes or Tai Chi. This category of physical activity increases social engagement, helps well-being and stress levels. The second type of physical activity identified is exercise training. These activities are more structured, which includes aerobic exercise, and are shown to improve physical health, including reducing blood pressure. Due to age-related changes, older adults as a whole are more vulnerable to sleep disturbances, although some subpopulations are more vulnerable than others. This includes older adults with predisposed sleep disturbances and medical conditions, older adults who are hospitalized, as 1 in 3 older adults that are hospitalized are placed on bed rest, therefore have no ability to engage in physical activity. Lower income individuals and rural populations may experience more limitations to mobility, and lastly, women have a higher likelihood than men to experience poor sleep quality. A longitudinal study by Hartiscu et al. Shows that a duration of more than 150 minutes per week of physical activity can improve symptoms of insomnia and sleep disorders. In order to make a sustainable positive change, they suggest that older adults should be frequently engaging in routine physical activity, along with supportive behavioral therapies to improve sleep disturbances. Theoretically, the mechanism of physical activity's effect on sleep quality is by intervening during the wake phase. The amount of time in the sleep or wake phase can determine the amount of energy, mental capability, behaviors, and stress levels of older adults. Overall, physical activity provides routine and motivation associated with well-being, which can positively affect sleep quality. A big limitation in studying physical activity and sleep quality is studying the bidirectional relationship between sleep quality and physical activity. Physical activity itself does not determine sleep quality, and vice versa, sleep quality can improve energy levels for physical activity but does not necessarily result in increased levels of physical activity. Challenges to this field of study include sample sizes, self-reporting bias, and leading questions, especially in surveys, many of which are cohort studies, as following up with subjects over a long period of time can be challenging. Furthermore, our gaps in knowledge, including the biological process of sleep disturbances, makes it hard for experimental structured designs. On top of which, it's hard to control for confounding factors associated with sleep disturbance. Although a lack of concrete evidence to prove physical activity's effect on sleep disturbances, physical activity can help improve other health conditions associated to sleep disturbances. Therefore, recommendations include over 150 minutes of physical activity per week, alongside 7 to 8 hours of sleep for older adults 65 plus, as well as combined physical activities such as aerobic exercise and sleep hygiene education. Sleep hygiene includes limiting naps per day during wake hours, avoiding substances such as caffeine during the night, avoiding foods before bed that could disrupt sleep, as well as ensuring adequate exposure to natural light. The combination of physical activity and sleep hygiene education has a reciprocal effect. Physical activity can increase motivation, while sleeping patterns or sleep hygiene can improve motivation or energy for physical activity. Overall, a healthy physical and sleep routine is crucial for older adult health.